So this vaginismus is not very uncommon. As I mentioned, because of any emotional trigger or due to conservative upbringing or due to fear of pregnancy or fear of intercourse or anxiety issues. Hi, this is Dr. Raksha. I'm a consultant gynecologist in Altis Hospital. I'll be speaking about a short topic called vaginismus. It is a condition which causes painful intercourse due to involuntary contraction of the muscles surrounding the vagina. So this vaginismus, there are two types. One is primary vaginismus and the secondary vaginismus. Primary vaginismus is due to difficulty in penetration from the first try, and it's mostly a lifelong condition. And secondary vaginismus is it involves those population who had previously had a normal intercourse or normal penetration, and post few incidences like maybe post childbirth or after menopause or post infection, they would have difficulty in penetration or difficulty in having intercourse. So this vaginismus is not very uncommon. The incidence ranges from 0.8 to 53% depending on the different population studied, and there are many causes for vaginismus. It could be maybe any emotional incidents or history of any sexual assault, or it could be some emotional trigger, or it could be a very conservative upbringing of the women, or it could just be involuntary contraction of the muscles by itself without any other condition triggering it. There are multiple symptoms associated with this condition. One, it could be as I mentioned, because of any emotional trigger or due to conservative upbringing or due to fear of pregnancy or fear of intercourse or anxiety issues, or it could be just painful penetration by itself, or it could be because of increased tone in the muscles surrounding the vagina and also increased tension in the hamstrings or abdominal or back muscles. And it also presents as bleeding post penetration because of less preparation or so. So there are multiple treatment options available for this condition. So earliest could be just educating the patient regarding the normal anatomy of the male and the female, and then secondarily it would go with sex therapy. Thirdly, it would go with basic treatments like pelvic exercises or so, and then relaxation therapy to get to reduce the anxiety associated with the condition. And then if still not working, then if it's too severe, then we could use even anxiolytics associated, which would reduce the symptoms and which would help the patient. And most commonly we use dilator therapies. Dilator therapies are quite effective. It could be post surgery, we try to relax and the muscles digitally or using dilators, and the patient starts using dilators, serial dilators according to the sizes, and increase the sizes as long as they feel comfortable to go ahead with the penetration without using the dilators. And the last resort is surgical option, wherein multiple incisions are made in the vaginal canal, splitting the muscles so that there is more space for accommodation during penetration. Each patient would require a different line of approach. So anyone facing such issues, kindly approach the medical professional so that whatever suits you the best can be provided to you. And it's in this era, it is not required to sit back at home and take everything. Rather, reach out to the medical professionals, and you could find solutions for it.